When you've made a promise and a commitment, stick to it.
We want our members to feel they can depend on us.
We want our members to know that we actually care.
I think immediately when I think about the scheme itself, it gives me peace of mind.
Like, you know, when you've had someone there for you all the time, like a friend kind of thing that's always been consistently there by your side, should you need something.
Certainly for me in the last 4 years, I haven't been exceptionally well. So having that medical aid support has been an absolute godsend.
Well, it is a trust, right? And when I say it is a trust, there's been 2 incidences when my son was born. We had a lot of problems with breathing and his asthma and all of that. So I was admitted in hospital every other week.
At the times when you need the scheme the most, that's when the scheme needs to show up.
You are actually engaging someone at their most vulnerable time.
It matters for me to know that should anything happen, we would be okay.
It gives me less to worry about because I know I have the cover that I need and, you know, for the lifestyle that I live.
That's very important. I think a healthier person is a productive person, is a happy person.
The old notion of prevention is better than cure actually truly does hold.
Absolutely. I mean, when I was diagnosed with chronic hypertension, I was 38 at the time, and I had my GP's finger in my face going, "You are far too young to be this close to having a stroke or a heart attack."
It's making sure that the knowledge on disease prevention is made available to our members, and I think we do a lot of that.
There's constant communication to look after your health, go for preventive screenings, you know, and if something's wrong, investigate, explore it, get it right.
We are trying to motivate members definitely to go out and get tested.
The Wealth Fund benefit is really a good example of how we do this.
It is probably one of the largest investments that has been made by the scheme into a benefit.
We're not just giving back in financial terms, but we're giving back in a manner that actually improves the scheme member's life by advocating for prevention.
So the Wealth Fund for me was something I discovered this year.
I actually got an email from the scheme saying that my dental check was covered by the Wealth Fund.
My son was able to go to the dentist, I was able to go to my gynecologist visits, so it helped.
From the time I received the first statement, I knew that that initial consultation had been processed as a claim that had been funded by the Wealth Fund. I was grateful for that. It didn't deplete my medical savings.
I mean, saving 1,000 Rand in your medical aid is a big thing when you have a child.
I think more so during COVID, we have realized that it's actually important to protect our members from a financial aspect as well. And so it has become incredibly important that we keep our contributions to levels that are actually affordable.
The role that we play in the scheme environment really allows us to impact a broader population of members and therefore have much more significant impact in having health gains in the broader sense.